Dual Loyalties. 2 weeks have passed since the bomb blast, and Dr. Samo considers his options.
What can I do? There must be a way to ensure people are safe and feel safe around here. Hundreds of people depend on me. What can I do?
A knock at the door snaps Dr. Samo back to the present.
Come in.
Lieutenant Colonel Glahan asks to see you.
I've been dreading this. Thank you, Anong. Tell him to come in. And can you make us some tea? Good morning, Colonel. What can I do for you?
Good morning, Doctor. If you have time, I would like to exchange some ideas on how to increase security at the hospital.
I was thinking exactly the same thing. The bomb has shaken my personnel and the patients alike. This is not an ideal environment for a hospital.
Well, we've secured the perimeter, and now nobody enters the hospital without a thorough checking.
So I'm aware. Complaints from staff have come in about rough treatment of certain patients. There are concerns we're limiting access for those who need care most.
I totally understand your discomfort, Doctor, but unusual times require unusual measures.
I guess so.
But there is one concern I would like to share with you.
Go ahead.
I can guarantee that nobody enters the hospital compound while armed. But I can do little to prevent harm planned from the inside.
Colonel, I'm not following. Please be clear.
Even if someone comes unarmed to the hospital, it doesn't mean he has no intention of doing harm in the hospital or elsewhere. A bit of extra information will help us prevent bombs like the one that hit the hospital.
A bit of extra information?
Yes, I'm sure you understand. Knowing details about the patients of this hospital, what brought them here, who comes to visit, will help us single out potential insurgent supporters and ultimately prevent other terrorist attacks.
Are you asking what I think you're asking? Are you aware that you are asking for privileged information? That you're asking me to break the patient-doctor trust?
I am aware of the implication of what I'm asking. But think how many lives could be saved if you make a little effort, Doctor. We're talking not only of the security of this hospital, but the security of your country. I would be careful before acting in a way that can be seen as support of a terrorist organization.
Tea. Here we go.
Thank you, Anong. Colonel, I think you made your point clear, and the only thing I can tell you is that I will consider your suggestion.
Yes, Dr. Samo. Think about it and think carefully. Remember, unusual circumstances require unusual measures.
What should Dr. Samo do? Why?